All right, well, good afternoon, Club 17, and welcome to another segment of Rotarian Spotlight. And of course, we're getting closer to perhaps meeting in the Hall of Mirrors, but we're not quite there yet. So I wanted to take the time to interview a number of Rotarians so that we can all get to know each other better. So today we are lucky to have Stephanie Byrd with us. How are you, Stephanie?
I'm doing well, thank you.
Well, we're looking forward to getting to know you a little bit better. As we've talked before, and kind of understanding your history. You've had service above self really written over your entire career. You've worked in healthcare and education, and really throughout the entire community. So I'm looking forward to hearing more about you here today.
Thank you.
So, well, tell us a little bit about yourself. Maybe a little bit about your family, your work history, maybe some of your hobbies and interests.
Sure. So I am originally from Indiana, born and raised in Indiana. Left Indiana many years ago to go to college at Miami University when Miami's teams were still the Redskins. So that tells you a little bit how long ago that was. And have spent really all of my adult life in Cincinnati. Went to Miami for undergrad and to Xavier for graduate school. I am fortunate to say that I have 3 adult children who are a combination of places. I have one son who's married here in Cincinnati, Austin, and a son in the DC area, actually living in College Park. He went to the University of Maryland and stayed. That's Aaron, and a daughter who is also in the DC area. She just finished law school. Unfortunately, her graduation was canceled, and the bar has been postponed. So she is really scratching her head trying to figure out what's next as they decide what's going to happen with the bar. And that's Alexis, and she and Aaron are housemates out in the College Park, Maryland area. So thankfully they're together, and I have one here. And I'm very grateful that right now they have not been as affected by COVID-19 as many have, and are either working or are getting some stipend for being furloughed. So knock on wood, and thankfully that's the case. I am fully enjoying my role at the Red Cross. It's been quite a journey for me. As you mentioned, I have been in the healthcare industry, also in the education sector via the United Way. Being here at the Red Cross now almost seems to be where I was supposed to be at this point in time in my life. And starting out in healthcare, my master's is in health and hospital administration from Xavier, so I'm also Muskie, love the Muskies. I started out of Xavier at Christ Hospital and worked there for many years. And by, circumstances being as they are, when the Health Alliance was formed back in the early 90s, almost mid to early 90s, I joined that organization and worked there for many years, and happened to be on the United Way board at that time. Shortly after my term on the board ended, I was asked to consider helping the organization start Success by 6, which was really the only way I would have ever ended up in early education. I'm not a teacher by background. I had young children, but I wasn't an early childhood educator. And so it was really, because of the circumstances that were going on in Cincinnati at that time, the right thing for me to do. And thought I would do that for 5 years and return to healthcare, and 5 years quickly became 14. And so it was a wonderful experience. Learned a lot about how important the first 5 years of a child's life are to who they become, their joy of learning, their ability to learn, and their ability to interact with others is all formed in those first 5 years. And yet, as a society, we just don't understand the significance of it and don't invest in it as much as we should. And so I spent that 14 years really trying to make the case for early childhood as a major investment in our community, really across our country. And it's interesting to see now where we are in understanding how important those years are, particularly preschool, and making preschool preschool more widely available. We now have the Preschool Promise here in Cincinnati because of the work that I was able to do along with many, many others to pass that back in 2016. And it's almost as though it's like kindergarten in terms of its acceptance as being a core part of a child's early learning experiences. So I thoroughly enjoyed that, but got to a point where I thought, it's probably, you get to a point where you know that you've done as best you can, as much as you can, and it's time to move. And so I kind of had that feeling, and it was at that time that Trish Smithson had announced her retirement, my predecessor at the Red Cross. So I went and talked to Trish, and based on that conversation and talking with others, it just seemed to be the right thing to do. And I did, and I am absolutely loving what we do at the Red Cross. Never thought I would be running to disasters and overseeing how disasters are handled in this region. But it's wonderful work. It's important. Again, something that people sometimes take for granted until they're in that circumstance where they need it, and there the Red Cross is. And it's great to be affiliated with an organization that has that kind of trust and reputation in our country. And I'm very fortunate to be here.
Well, it's a wonderful feeling to be in a role that you really enjoy and you love, and you know that you're doing good things to support others. So, well, tell me a little bit about maybe a fun fact about Stephanie that no one else knows in Rotary.
Oh my gosh. Fun fact. Well, I've got a few of those. I guess the one that I guess I laugh at now, when I was going through this, I didn't know how interesting it was, but my last class when I was in undergrad was a wine tasting class. It's how I developed my love for wine, which I do love, and wine tasting. And, I took it pass fail because it was the last class. And I thought, this is just something to play around with. It was the hardest class I've ever taken in my life. And I struggled, and I passed it by the skin of my teeth. And I'm like, oh my gosh, I will never do that again. My mother at that time was not happy that I even took the class, but I enjoyed it, learned a lot from it. I still, think back to what I learned, and, it's been helpful for me now as I like to cook and, serve wine with my meals, and to have that knowledge, which I almost didn't pass, it's kind of funny because people don't think it's as difficult as it is, but it is not an easy course. So if you take it pass fail.
I will do that. Sounds good. So, in your role with the American Red Cross, you have domain over 27 counties in Ohio, Indiana, and in Kentucky. So, which is a huge responsibility. So tell us what an average day looks like, and even more so what it looks like now because of the COVID crisis.
Sure. So what you aren't aware of, this happened at the beginning of this month, my territory has now expanded and includes 47 counties.
Wow.
And it is the greater Cincinnati-Dayton region that I've had, which is 27 counties, but also now encompasses Columbus, and as far north as Richfield County, which is where Mansfield is located. Mm-hmm. And so it has taken what was already a large region and doubled the size of it, which happening at this point in time is really a challenge, because the most important thing to me is building a team and understanding the needs of your team, creating that culture of camaraderie and mission, and understanding what our clients and our communities expect of us. And it's very hard to do that when everyone is working virtually. And so it has been a joy to be able to have that additional responsibility, but also a frustration because I can't really get out and meet people and be becoming familiar with my larger territory because of working from home. Mm. If there were a typical day right now, for me, it is probably checking in with staff. I have a morning briefing with our disaster team twice a week. and an afternoon briefing with my leadership team 3 times a week, just so that, I understand what their needs are, what challenges they faced, or what's coming down the pike in terms of disaster. I also check in with my board chair, and board members throughout the week, just to see how they're doing. Largely because you develop relationships with these folks beyond just them being board members. We still are conducting a lot of our business, though, virtually. We've had a board meeting virtually now. I invited our board members to listen in on a conversation with Rick Lofgren, who is the CEO of UC Health, because he is also on the governor's coronavirus advisory task force. And so he shed light on where we are as a state, and some of the planning that we've done locally, which I think board members appreciated. And so it's really just trying to stay connected with the people who make our work happen. Key to that is our volunteers. We've hosted an all volunteer call last week, just to update them on the organization's current state as it relates to COVID-19, thanking them profusely in all ways for what they do. I don't know if you're aware that 90% of our work is done by volunteers. And so they truly are our workforce. And so being able to thank them and be on a WebEx with them where I could see their faces and they could ask questions, it makes it, almost doable, and less of a challenge that we're not together face to face. And so no real ordinary day, but some things that I like to make sure happen throughout my week to kind of keep my finger on the pulse of the organization.
Well, it sounds like you're spending a lot of time trying to make sure that everybody's connected and engaged in your organization, which is tremendously important right now.
Well, and thankfully the technology allows us to do that. We've learned a lot about what we can do through a virtual environment, that some of that we'll probably continue doing beyond whatever the new normal looks like. But having the technology that allows us to stay connected, and the platforms like this that make that happen, has been key to our being able to stay connected.
No doubt about it. Well, let's talk a little bit about your Rotary experience, and
Yeah.
even more importantly, not importantly, but additionally, with the long line of Red Cross folks that have been involved in Rotary. You mentioned Trish, and
Yes.
there's a number of others, but tell us a little bit about that history between Red Cross and Rotary, and then maybe a little bit about your experience so far in a little bit less than a year.
Well, I think that the mission of the Rotary and the mission of the Red Cross are so similar. Ours is to basically be there to help people in the face of emergencies by bringing the generosity of donors and the strength of volunteers together. And I think about what we do in Rotary and the mission of Rotary. It would make sense that we would be involved in the organization because of our being in service to others as Rotarians. And I think about our pledge, and how important that is to what I say to our team. And so I hadn't thought about joining Rotary until I became a Red Cross executive. But one of the first things that Steve Drapel said to me was, "You've got to join Rotary." And then I paid attention as to what Rotary was all about, and came and visited, and talked to Trish Smithson about it, and came to understand the long line of Rotarians who were also Red Crossers, and why that happened. And so I happened to be able to talk to Pat Eatonson earlier this week. And she was a former CEO of the Red Cross, but the first female CEO or president of the Rotary, Club 17, many, many years ago. But it kind of crystallized for me how she saw Rotary then, and why she participated, and how similar it is even today. She's still very active down in Florida, where she lives now. And the work that she's doing is very similar to the work that we're doing here. And our support right now of families who need help, either the staff who we've helped at the Hilton, or the people that we've helped with at Cincinnati Public Schools with food support, just tells me that this is an organization whose principles and values are aligned with the work of the Red Cross. So to me, it's been a partnership that allows us to carry out not just the mission of the Red Cross, but also to do that through a broader mission of Rotarians.
Yeah, I couldn't agree more. I mean, when you think about how similarly aligned we are in many, many things that we do, it's a good feeling to have you as a member and really have that long line of folks, including Sarah Peller, who's in the club as well. But it's been a great partnership and relationship for many, many years. So, well, Rotarians, I think that you got a really nice glimpse of why Stephanie is not only a leader in this community, but is just a perfect fit to be the leader of the Red Cross. So I really appreciate you taking the time today, Stephanie, to be with us and for allowing folks in our club to get to know you as well.
Thank you so much, President Dave. Good to see you. Stay safe and stay well.
Absolutely. Look forward to hopefully seeing you soon in the Hall of Mirrors.
Thank you. You
All
too.
right. Take care of yourself.
Thank you.